Hey guys, I'm Dr. Craig Mortensen. Thanks for registering to check out my webinar. And if you're signed up to get the webinar series, thanks for checking it out. So I've got a couple different screens going here. So sometimes I'll be looking at the camera and sometimes I'm going to be looking up at the screen here. So just be aware of that. Now we've got quite a bit of information that we're going to be going through here. So I've broken this down into a couple different stages or categories, and we're going to limit it to about 15 to 20 minutes per webinar. You're going to get about 3 webinars. In the first one, we're going to talk about how your gut determines your overall health and really why you should care, right? This is why we're talking about all this stuff. In the second one, we're going to go over how to test and assess your current gut health and some tests that you can do at home, and also some tests that are some of the common tests that you can send out for to evaluate how your gut health is doing. So a lot of good information in that one. That one's going to be an information-packed one, so you might want to get a notepad and a pen, piece of paper and a pen, and write some stuff down. In the third one, we're going to go over the 5-step plan that you need to follow in order to finally heal your gut. And it's fairly, you got to follow directions, you got to do it right, or you can mess yourself up. So here we go. Okay, let me look up here. So it is health that is real wealth and not pieces of gold and silver. This was said by Mahatma Gandhi. And as people get older, they never really say, oh, I wish I had more money, or things like that. It's always, I wish I would have taken better care of myself or spent more time with family or whatever the case may be. So you kind of have to, when we're talking about health, you kind of have to shift your thinking about, sometimes you got to spend some money to get healthy because it's not always the cheapest route. So let's move on here. So this is our agenda. So we're going to cover kind of the first one in this this webinar. The second and the third we're going to cover in the second webinar or second stage of the webinar, and then the fourth one we'll go over at the end. This is my disclaimer here. So this is not claiming to diagnose, treat, cure, prevent any of that stuff. This is only for educational purposes, and I'm not just because I'm giving the seminar, I'm not accepting you as a client or a patient, blah, blah, blah. So read that and just kind of all the normal stuff. So this is some of the ways, and this is a very short list of how your gut health determines your overall health, or at least significantly contributes to it. So number one is inflammation. The gut and the GI is one of the biggest contributors of inflammation. And when inflammation is all out of whack, it's a pretty big buzzword right now. So it really can cause a lot of issues, from chronic pain, fatigue. It contributes to heart disease, autoimmune issues, all that kind of stuff. And that brings us to number 2, autoimmune. So 70–80% of all your immune system is located in the gut. So if your gut's not healthy and you have an autoimmune disease, then you're not going to get very far. And this also goes back to the fact that if you have leaky gut, let me back up. If you have autoimmune, you have leaky gut. If you have a leaky gut, you either have or will be getting an autoimmune. They're that tightly related, and we'll discuss that a little bit more, I believe, in the second webinar that you'll be getting. And I'll kind of explain that process. So the third one is thyroid. This also has to do with how your body detoxifies. So if you can't get rid of those toxins, toxins are either mimickers or blockers. They mimic how certain hormones work, or they're going to block certain hormones. And then they also have 20% of the conversion of T4 to T3. And then we're also dealing with leaky gut and autoimmune issues. We've got energy. Again, it has to do with hormones and being able to detoxify and convert, adrenal fatigue. If you've got diabetes, we're looking at the pancreas, hormones, glucose, and metabolism. This stuff is all related to the gut. So a lot of people start taking supplements or doing medications or whatever the case may be to address some of these issues, and you can have some improvement, but you're only going to get so far without having a healthy gut, because so many other things are dependent on how your gut works. So mood, and we're mostly talking depression and anxiety. 60 to 90% of all your neurotransmitters are made in the gut. So if your gut's not healthy, then it's hard to be mentally stable and feel right in the brain. So it plays a big role in that. And again, we go back to hormones, detoxification, and conversion. And then another one for a lot of, especially younger adults. So younger and older. The mid-range tends to be okay. So skin health. Health comes from the inside out. So we're looking at fatty acids, amino acids. So it's not just what you eat, but it's what you eat, digest, absorb, and assimilate. Right? So you can be putting on all this good food, but if you're not doing all those 4 steps, then you're not getting the benefits of those foods. So any of this stuff that we're going to be going over today is all evidence-based stuff, right? So I'm a functional medicine or functional healthcare practitioner. So I'm really concerned about how is the body functioning, or more importantly, how is the body dysfunctioning. So all this stuff that I'm telling you about, you can look up on your own and verify all this stuff. So don't take my word for it. Don't take anybody's word for it. That when they tell you something, go look it up. Now, a great website, one of my favorite websites, and my presentation thing is not quite working 100% here, but the website that I use is pubmed.com. So pubmed.com. It's a great website. You can just go on there, and it has a bunch of peer-reviewed medical journals and all that stuff that's researched, all the supplements. So just type in, like that first one, I looked up mental health and gut issues, and a bunch of stuff comes up, and thyroid and gut issues. So this is all evidence-based studies. I'm not just making stuff up. So this is not swag, right? And what swag stands for is a scientific wild-ass guess. Right? So look it up, right? Okay, next one. So as we're going through this, now for the webinar attendees, this is kind of more for you, for people that are getting this kind of after the fact, not really so much. So a lot of times especially when I do these live seminars and stuff, or webinars, not in-person seminars, I'll get handfuls of patients that will be asking, oh, I've got such and such, or my friend has this, what should I do about it? Well, as you'll see, it really all depends. So hold your questions for the end. We'll discuss all that stuff and try to go over as many things as we can. Now, when we're talking about health, think of your health as like this web, right? All of your different, and hopefully you can see my cursor over here. So a lot of times in the medical community or healthcare, we tend to kind of compartmentalize all our different issues, right? So we've got GI specialists, neurologists, psychologists, podiatrists, all these different specialties, and they only do what they do. They don't look at the whole body, but that's not how the body works. So what happens a lot of times is, think of your body parts or systems all on this web, right? And so if you've got something over here and you're having an issue with that, we can work on that a little bit, but all these other things are going to have a ripple effect and work its way over and have an effect on that system. And you'll have a little bit better understanding with this case example. So with this case example, this was Lisa. And some of her symptoms were she gets hives when she eats, and just about when she eats anything. So she couldn't really eat anything, yet she was gaining a bunch of weight. She couldn't lose any weight. She had insomnia, aches and pains all over, very similar to the fibromyalgia type stuff. She had lots of UTIs, swelling with exercise, eczema all over. And this wasn't really a complaint, but more of a thing that she had noticed was that she had been infertile, for about 15 years, and she and her husband had not been using any protection, and she'd actually been off of birth control for 15 years. So they had kind of come to the point in their life where they were just kind of at peace with that and weren't really concerned too much about it. She had also had a history of antidepressant use, and this was one of the main reasons that she was coming in to see me or get my help. But she had to go off of those antidepressants because of the side effects. She could not tolerate them. And she had a long-term history of constipation. So she came into my office and we kind of start looking at that, that web on how her body all fits together, and we started working on these things. So we started addressing her adrenal fatigue issues, her neurotransmitter balance, her gut health. We did toxicity. We did a bunch of food sensitivity testing on her, and we started working on all this stuff. And the first 3 months, she started doing really good, like really, really good. And then in about month 4 or 5, she comes in. She's like, "Man, I am super tired. I feel like I went so far backwards now. I don't know what's going on." And it's like, well, sometimes it can happen a little bit, but usually not to this degree. So I said, let's give it another month. Let's continue to work the plan and see how you do, and then we can kind of reassess and go from there. So next month comes in, and she sits down, and her eyes start watering, right? And I'm thinking like, oh my goodness, what's going on? So, and then she comes out and she says, "I'm pregnant." And I'm just thinking to myself, oh yeah, like, self high five, patting myself on the back, good job, right, all this stuff. And she's like, no, my husband doesn't want kids. And, he's kind of in a depression now. He's just laying on the floor. And he thinks that there's kind of some funny business going on in the office here because I haven't been able to get pregnant for 15 years. I'm like, whoa, okay. Why don't you maybe bring him into the office so we can talk a little bit here. Anyway, long story short, they worked things out. He came to grips because he had come to the point where, he was a little bit older in life, and where he was okay with not having kids. So it was a real big shock. But over the period of just really the next couple of weeks, he just did a complete 180, and they are just on cloud nine, as happy as can be. And I'm super happy for them. So that was a really good, it was a really good outcome from her. And her spider web, so to speak, kind of looked like this. So she had all these different issues going on, right? And at the center of this, we've got gut issues. So let's say she comes in for anxiety and depression. That's kind of her main complaint, right? But she's got all these other things. So neurotransmitters are one of the big things that we want to work on. But we can try to do some stuff for neurotransmitter balance, but if we don't look at this other stuff, you're only going to get so far, right? All this other stuff over here is going to be left alone. You're not going to address those issues. You're only kind of addressing one half of this circle. So there's a lot of stuff to look at in this process. So we want to start at the beginning, and the beginning is the gut. So a lot of times after the end of all this stuff, you're going to feel like this, right? I'm going to throw a bunch of information out there, and a lot of this stuff, some of you are going to be able to take on your own and run with it and make some good progress. For those people that aren't, that's what I'm here for. So just kind of keep that in mind. And the running theme of this webinar is this: all disease begins in the gut. And Hippocrates said this, and he's got some other really good sayings that he said. But just kind of ingrain that into your mind anytime you're thinking about health, trying to get healthy or restore health and stay healthy. So why are we really here? Well, main reason is this, right? You're doing it all wrong. So there's a lot of information out there. There's Dr. Google, there's all these different things, and people have a bunch of wrong information. And oftentimes they are making things worse by doing it wrong. They're going about it backwards. They're taking different steps out of order. They heard something on a website or from some blog, or a friend or family member told them something, and this is the stuff that they're doing it wrong. So what's the point? Why does it matter to you? Well, because everything starts in the gut. So health starts and ends in the gut. There's a lack of effective treatments. There are treatments out there. There's a lot of different medications and things that help with symptoms. But for the most part, they're not addressing the root cause. And if you can figure out what that root cause is, that's really what you want to get down to. So medications don't always address the causes. Majority of the time, symptoms over time will get worse. And there's a lot of confusion and frustration. People are trying a bunch of different things, nothing seems to be working, trying to take a shotgun approach to things, and they're getting nowhere fast. So all disease begins in the gut. Okay, this is, I don't know if my thing's going to work here, but this is a great graph, and I always try to, in my in-person presentations, I always try to get people to guess what this graph represents. And let's see if it comes up here. No, okay. So right at the top here, it should say world prescription use. So the United States uses 75% of the entire world's prescriptions, and yet we're nowhere near the healthiest countries, in which we'll go over that. We spend over 2 times the amount per person than the next country. That's pretty sad. So it kind of begs the question, if I go to the next slide here, kind of begs the question here, right? Being in the healthcare industry, I definitely feel and yeah, enough said. Big bucks, big pharma. There's a lot of money in this, so you know it's sometimes hard not to get a little bit of jaded view. Now that's not to say that medications don't have their place. They definitely do, but they're very much overused. So this is the height of $3 trillion if you were to stack $100 bills, which is a whole lot of money. This is the same amount of money as Italy's entire debt. This is how much we spend on healthcare every year. On diabetes alone, we spend $245 billion per year, which is primarily a completely preventable disease. And we spend 19% of our GDP on healthcare. Now, the United States definitely has the best acute care in the world. So if I get in a car accident or break a bone or some sort of trauma or something like that, there's nowhere else I'd want to be than in the United States. Right? We've got that down. And here's a list of 10 countries, and I won't make you guess because there's, it's hard to have people guess here, but this is the list of the top 10 healthiest countries. And the US, okay, let's see if it's going to come up. Okay, here we go. Here's another list. So this list is the top 10 obese countries. So it's pretty sad. Now, as far as the healthiest, USA is number 33. And this is as of the end of 2016. And on that previous list, Italy has moved up to the top there. So we're below the Czech Republic, just above Bosnia and Herzegovina, which I've never heard of. And to put this into a little bit more perspective, Cuba is number 28. Cuba has a healthier population than we do. The United States has one of the highest chronic disease rates in the world, which is pretty sad. And this is the acronym for the American diet. It stands for the Standard American Diet. And this is how the rest of the world, what they call our diet. And part of the reason for that is because of this. 10 companies control 90% of what we eat. So what do you think people are eating? Right? So what do we do? Panic or don't panic? Well, oftentimes it feels like the sky is falling and there's nothing that we can do. And you feel like you're doomed. Just know that you're not. This is something that many of my clients, they have all these issues, all these different things that we're trying to address, and they feel like they're getting nowhere fast. So I want to give you a good place to start. We're going to start in the gut, which is most of the time where most people want to start or need to start. So stay tuned. On the next webinar, we're going to be going over to how to test and assess your current gut health. We're going to be talking about some common digestive issues such as SIBO and leaky gut and dysbiosis and different enzymes and things that you can look at on these lab tests to assess what your current gut health is. And then on that third one, again, we're going to do the 5-step plan for restoring gut health, which is a lot of good information. So So thanks for tuning in. You'll get my next email probably tomorrow or in a couple days or so. And if you have any questions in the meantime, shoot me an email. And if you'd like to schedule an appointment or something, feel free to give my office a call. I'm Dr. Craig Mortensen. Be healthy, be happy.